there are many ways that you can describe our healthcare system here in the United States. Um, Probably the most fitting is barbaric, because before the pandemic, it was like some type of capitalist hellscape, our healthcare system in this country, where basically the decision on whether we live or die basically comes down to whether or not it's in the best interest of for-profit private health insurance companies to treat us and to give us life-saving care. And there's so many different aspects to it. Just the are outrageous, the price gouging, and the insane prices that people have to pay for basic healthcare or basic coverage that doesn't really cover all their needs, their healthcare needs. The fact that 500,000 people in this country go bankrupt every single year. This is before COVID. They go bankrupt because they can't afford to pay for their medical bills. Like, think of how many lives have been permanently altered because, as human beings, it's going to happen to all of us eventually. Inevitably, we'll get sick and we'll require healthcare. And because that happened to some people through no fault of their own, they had to get treatment and it cost them everything, and they had to go bankrupt because of it. 500,000 people every year. How many lives, how many families have been they've been permanently altered because of that? That's hard to wrap your mind around. But aside, like I said, the price gouging aside, it is the part that I'm really shocked that more people aren't focused on is the outrageous amount of death, unnecessary death. And it's one thing, of course, in any healthcare system, there are going to be people who get sick and die. As far as I know, no country has it down pat to where there are absolutely no deaths from any natural causes. But the thing here in the United States that is completely inexcusable is the tens of thousands of deaths that happen every single year because people can't afford basic healthcare. Basic healthcare. And there have been studies about this. The most recent one before COVID said that 68,000 people died every single year in this country because they couldn't afford basic healthcare. Died unnecessary, preventable deaths. These are people, regular people like you and me. They had families just like you and me, family and friends and hobbies and ambitions and things that they wanted to do in their life, change that they wanted to make in their life. All of these regular people with their own stories die unnecessarily because they can't afford basic healthcare. Things like life-saving drugs, like insulin. The price of insulin has gone up like 300% over the last few decades. Same exact drug made by the same exact companies with this in the same factories, but for no other reason other than something capitalism, they've jacked up the price of life-saving drugs like insulin over 300%, to the point where people can't afford to pay for it, even though that drug is keeping them alive. That and other prescriptions that people can't afford. Things like untreated high blood pressure and heart disease that lead to people's deaths. People getting diagnoses, and this is another thing. Now you get a diagnosis that you have cancer or something like that, or you have some sort of life-threatening disease. And it's not that as human beings, as a society, we just don't have the tools available to save your life. The options are all there. The doctor could present you surgeries or radiation treatment or any other type of treatment to deal with those type of life-threatening diseases. They have those all there, but you get the diagnosis and you just can't afford the treatment. So you go home and you die. That happens thousands of times every single year in this country. And just the scale of death that we have accepted because of this. I mean, it really is stunning. It really is stunning, and it goes to show you the power of propaganda in the media and in our education system. Because in any rational, sane world, people will be up in arms about this. Because these are, like I said, these are your family, your friends, your loved ones. People dying unnecessarily. But like I said, because of the propaganda, people aren't really putting the dots together that this is a systemic problem. And it's not some force of nature that's causing this. It's the explicit policy decisions by our politicians to serve their corporate donors in the private health insurance industry and big pharma. It's those decisions that are causing the deaths of the people that you love. It might cause your death eventually one day. And like I said, the scale of death is, it's I cannot put it into words. 68,000 people dying every single year, preventable deaths, unnecessary deaths. That's more than any war zone on the planet. Any genocide that a dictator is conducting, any dictator that the U.S. is backing is conducting, any just flat out imperialist interventions like what we're doing in Syria, in Iraq, and in Yemen, more than all of those individual war zones, people die unnecessarily here in the United States because they can't afford basic health care. The for-profit private health insurance companies and the politicians in this country have more blood on their heads than any dictator around the world. And it doesn't have to be this way. That's one of the most frustrating parts about this. It doesn't have to be that way. You know how many people die in Canada or France or in the UK or in any other modern industrial country that has single payer? You know how many people die because they can't afford basic health care? Zero. It's not 30,000, it's not 40,000, it's not 20,000, it's not 10,000, it's not 500. It is zero. Because if they need healthcare, if they need treatment from a medical professional, they go and get it, and it's free at the point of service. So, for completely arbitrary capitalist reasons, when you cross the border into the United States, suddenly it's acceptable for people to die because they can't afford healthcare. That's what's happening in this country. And then you get the pandemic. So what the pandemic did, this public health emergency did, it compounded on top of the previous public health emergency of just a lack of healthcare in this country. And again, that is something that is impossible for me to put in words, because COVID didn't make the deaths from the unnecessary deaths from not being able to afford basic health care. It didn't make that number just go up. It multiplied that number. There is exponential growth here, because now there's this deadly pandemic that's being spread across the country, and people can't. Before the pandemic, they couldn't afford to go to the doctor. How many people have gone years without seeing any kind of doctor? So before the pandemic, people couldn't afford to see a doctor. Now there's this deadly pandemic spreading. A lot of these people are forced to go to work or try to make money somehow anyway. And they get exposed to the virus. They get sick. And if they went to the hospital, if they went and got medical treatment, maybe they could have improved. Maybe they would have gotten better. But a lot of people made the decision that, you know what, maybe it won't be that bad. Maybe I can get over it. But what I know for sure, if I go to the hospital, if I go to the doctor, they're going to wipe me out, and I'll have absolutely no money, and I'll be bankrupt. That's the calculation that a lot of people made, and that's one of the reasons why there are hundreds of thousands more deaths here in the United States than anywhere else around the world. And that's just one aspect to how COVID has the lack of single payer healthcare in this country has exacerbated the pandemic here in this country. You have the people who need treatment but know they can't afford it, so they don't get it. Those people get sick, they stay at home, they get worse, and they die. Then you also have the fact that early on there was many stories about private hospitals closing because now that they were overrun with COVID patients, and they had to shut down all of the elective surgeries, and that's how a lot of these private hospitals keep the doors open. That's how they cover a lot of their expenses with like expensive plastic surgeries and other elective surgeries and things like that. So now that the pandemic happens and a public health emergency, and people had to move away from those types of things and focus on life-saving care, now many hospitals around the country, they didn't have the money to stay open to treat people in the middle of a public health emergency. And a lot of them ended up closing their doors or laying off staff. And in a lot of cases, those were like the only hospital that people would have in their area, in their town, in their community. Objectively, the fact that we don't have single payer in this country made the pandemic worse. It made the deaths even way higher than they ever should have been. And millions of people got sick, and the hundreds of thousands of them who did get treatment, a lot of them got bills for tens of thousands of dollars, some of them hundreds of thousands of dollars that they now can't pay back. And again, through no fault of their own, for no fact other than they caught a pandemic in the middle of a public health emergency. They caught a virus in the middle of a pandemic. And I have to say, one of the biggest reasons that I ended up supporting Bernie Sanders and got behind that movement of trying to elect progressives is because nobody else in this country, not the media, not the education system, not the elected politicians, nobody else was making as big a deal about how barbaric our healthcare system was and the inexcusable deaths that were happening every single year. Nobody else was really making a big deal out of it as much as Bernie Sanders was. So that really, and of course many of the other policy issues, but that was one of the main things that attracted me to this progressive movement and progressive politicians like Bernie. So you have to understand my disappointment in those same politicians that in the middle of the public health emergency, this pandemic, where we need single payer now more than ever. And if there was ever a time to burn all bridges and go scorched earth and go to the mat to get this policy, if there was ever a time to do it, it would be right now. And if there was ever a chance to get it passed, to have enough public backing and enough public outrage to force the hand of these corrupt politicians to make this pass single payer into law, if there was ever a time to do it, it would be right now. So it is incredibly disappointing that those same people who rose to prominence talking about the urgency of our healthcare crisis in this country now just kind of shrugging their shoulders and being very passive about the fact that there's still no real push to get single payer, even though it will deal with the many problems, the pre-COVID problems, but also it's a direct solution to the unprecedented emergency that we're living in right now. Public pandemic and the worst economic crisis in history. Medicare for all, single payer, would be a huge solution to those problems. In a sane world, if we lived in a country where the government was actually concerned about their citizens and actually concerned about governing and solving problems above corporate interest, they would have seen what was going on before the pandemic and provided single payer. But they would have seen the scale of the crisis and said, okay, we obviously need some sort of national healthcare system in this country because this is unacceptable. And from the moment we knew how bad the pandemic was going to get, there should have been immediate plans to draft some sort of single payer system and put it into implementation and implement it as soon as possible. That would be the government response to a public health emergency in a sane world. But of course, we're in an oligarchy, a corporatocracy, where these corrupt ass politicians, above everything else, their top concern is serving their corporate donors in the for-profit health insurance industry and at Big Pharma. And because of that, the only solutions that have been, or the only policies that have been proposed to deal with this, our failed state healthcare system in this country, the only policies that have been proposed are more subsidies to the private health insurance industry, more blank checks for Cobra and Aetna and Blue Cross Blue Shield, and giving them endless amounts of money to deny people coverage, and so that their executives can make out like bandits and get rich off of all of this. That has literally been the only healthcare policies proposed by our government at this point. A year into this pandemic and economic crisis. And the fact that Bernie Sanders, AOC, Ilhan Omar, Rashida Tlaib, Cori Bush, Jamal Bowman, Pramila Jayapal-O'Connor, all the Justice Democrats, the fact that all those same people who, when it was convenient for them to talk about, oh, it's an existential crisis in this country, there needs to be an urgency, thousands of people are dying because they can't afford healthcare. Those same people who use that rhetoric to get elected and to get the support of millions of people, working class people and poor people in this country. Now, when they, in this crisis, they are very lax. There is no urgency from them to implement the policy that they claim they want more than anything, which is single payer. And before anybody comes out and tells me, oh, what can they do? They're just a handful of people, and there's hundreds of other corrupt politicians who would be against it. Sure, but I'm not saying it's a guarantee easy win, but there's a fight to be had, and they just refuse to do it. They refuse to call out the corrupt Democrats who are the sole obstacle to passing single payer right now. The Democrats control the House, the Senate, and the White House. The only reason why we don't have it is because their leadership is so corrupt that they will deny people healthcare in the middle of a pandemic. And instead of fighting them and being adversarial and hostile to Democratic leadership on the issue of healthcare and many other issues, they decided to take a step back and let the corporate Democrats run the show and let them decide the healthcare policy with no pushback. And they do have leverage. They do have power to influence policy. That's what makes this extra frustrating, because they actually do. And don't let the numbers fool you. Like we've talked about because of forced to vote, and we've talked about during the passage of the stimulus bill, all it would take is 6 Justice Democrats, and there's about 12 Justice Democrats in the House. All it would take is about 6 of them to say, I'm not voting for X, Y, and Z unless single payer is in there. They could have done that. They could have made the demand in this stimulus bill that we won't vote for this unless we pass single payer, because this is something we should have done from when we passed the CARES Act. And we passed 3 stimulus bills since then, and none of them are creating a single payer healthcare system. All they do is give billions of dollars blank checks to health insurance companies. So we aren't voting for the stimulus bill unless there's single payer in there. They could have done that. Maybe they could have won, maybe they wouldn't have. We all know damn well they had the votes to do it during the speaker's race. They could have denied Nancy Pelosi the speakership. They could have denied anyone the speakership, unless they got a floor vote on Medicare for all. And they chose not to do it. Got nothing in return for their vote. No vote on single payer. I talked about it a while ago on the show, how Bernie Sanders, chair of the budget committee, he actually wrote the stimulus bill. So piggybacking on what I was saying about 6 Democrats in the House could have demanded a single payer be in the bill. Bernie Sanders wrote the stimulus bill, so he could have wrote it in there. He could have wrote single payer into the bill and said, I dare the Democrats to kill this. I dare them to deny people health care in the middle of a pandemic. He could have done that. If he really wanted to be adversarial and hostile and confrontational with Democratic leadership and challenge them to actually do the right policies, he could have done that. And let Joe Biden come out and make the public case why he's going to go and expend political capital trying to make sure that people don't have health care in the middle of a pandemic and economic crisis. Let them make the argument. Let Nancy Pelosi and Chuck Schumer come out and say, yeah, we gave trillions of dollars to the richest corporations and the richest people in the country. Yeah, we let Jeff Bezos, the richest man on the planet, double his wealth during all this. We let all the billionaires basically double their wealth throughout all of this. But we will not lift a finger to provide you health care in this emergency. Let them all make the case. Bernie Sanders could have put them on the spot like that and could have made organized all his grassroots supporters, his millions of grassroots supporters, organize them to do public pressure campaigns and direct actions to pressure Democratic leadership to fold on single payer. He could have done that, but he didn't. And when he was asked by a reporter from Politico, so you're budget chair now, what are you going to do? He's budget chair and the Democrats have such a slim majority in the Senate. All it would take is one senator to kill a bill. And Bernie Sanders could kill any bill unless his demands are met. So they asked him, what are you working towards on healthcare? What are you going to do? How are you going to implement single payer? And he said, what we will be doing is working in the context of what Joe Biden wants. So for those of you who aren't that up on politics, Joe Biden is fiercely against single payer. He has been his entire career. Not because he thinks it's bad for the country, because he's a fucking corrupt ghoul. He takes hundreds of millions over his career. Him and the Democratic Party have taken hundreds of millions of dollars from these same people, the only people in the country who benefit from this corrupt, decrepit, barbaric healthcare system. He takes hundreds of millions of dollars from them, and because of that, he will go to the mat to fight against single payer, which is objectively the solution to the healthcare crisis in the country. Pure corruption. Rank corruption. And don't tell me he actually believes that shit, because Joe Biden knows goddamn well every other industrial country on the planet has single payer, and he knows their healthcare system is way better than the bullshit we have here. So don't give him the benefit of the doubt here. It's rank corruption. And Bernie Sanders knows this. He knows Joe Biden has tried to kill single payer. Joe Biden was trying to kill single payer when he was vice president to Obama. He killed the public option in the Affordable Care Act. Joe Biden, this is the same Joe Biden who, in the middle of a fucking pandemic and economic crisis, he was going around doing interviews with people, telling them, I will veto Medicare for all if it ever passed my desk. If it miraculously passed Congress, passed the Senate, and got to my desk as president, I will veto it because I'm that corrupt. This is the same Joe Biden. And so then for Bernie Sanders to come out and say, quote, what we will be doing is working in the context of what Joe Biden wants. That's the white flag. He's waving the white flag. He says, I'm not even going to try to get single payer. I'm just going to do weak-ass tweaks to Obamacare, to the Affordable Care Act, and to Medicaid, and act as if that is actually a solution to the problem. And then this brings me to the topic of this video. AOC did a live stream a couple of days ago where she was talking about what was in the stimulus bill. And the queen of single payer herself comes out and she was basically bragging about the tweaks to the Affordable Care Act, the little subsidies that they put in there, the fucking giveaway to Cobra. She was basically bragging about it as if it's a good thing, as if it's something that we should be happy about. As if that really addresses any of the healthcare problems in this country. She was out there bragging about it. And if you actually listen very closely to what AOC is saying there, she basically admits that there is no plan to get single payer during this crisis. She says that she's happy about, she's elated, she's ecstatic about the fact that in this bill, it provides some cost-saving subsidies to your health insurance plan if you purchase it through Obamacare over the next 2 years. It provides some savings for you. And she's bragging about that. So wait, let's look at the timeline here. We're in the middle of a pandemic, worst economic crisis in history. Single payer is the solution right now. But she's bragging about tweaks to Obamacare that will last 2 years. Make that make sense if you're actually fighting to get single payer right now. She's not. So this gets to something that the point I've been trying to make for a very long time on this show. At what point can I just call you a neoliberal? At what point are you just one of the regular ass establishment Democrats? You don't take corporate money, so I can't call you a corporate Democrat. But you are defending the status quo. You're trying to sell the status quo as if people should be happy about it. And you are outright saying, oh, isn't it good that we just give subsidies to these goons in the private health insurance industry so that they can continue to price gouge people and deny people coverage instead of using that money to actually give people healthcare coverage? So the argument I've been making, how many times can you vote for in career-defining moments? How many times can you vote for and support and go along with neoliberalism and austerity before that's just your actual political ideology? Because if you went along with the CARES Act, you voted for all the other stimulus bills and all the corporate giveaways and the austerity and the means testing, and you refuse to push back at all and demand actual universal programs to counter those policies, those neoliberal policies, and you just vote along with it with providing no pushback, no opposition. Okay, so how is that not a neoliberal? Just because you tweet Medicare for all, just because you have it on your campaign website, that overrides everything else, and you're still a socialist or whatever because you tweet single payer, you tweet universal basic income. But do you actually use any of your power to get us there? No. Do you actually use any of your leverage to bring us closer to getting those policies? No. But what you do is vote for shit like COBRA subsidies and subsidies, blank checks to the private health insurance industry, and then you go and tell people you should be happy about it. That sounds like some shit a neoliberal would do. So, in my book, you're just as bad as the rest of the shitty neoliberals trying to sell and defend the status quo, even though it is clear as day not working and not meeting the moment. So I have the clip. I'm going to show it to you guys. I'm going to come back and break it down. But first, y'all already know the deal. You can contribute to the show financially through Patreon. I don't do Patreon exclusive content. It's just a way to help support the show monthly without even thinking about it. And also have links to PayPal in the About page of the YouTube channel if you feel more comfortable doing a one-time contribution. And I am in a little bit of an emergency. So my car broke down at the grocery store. And now I have to tow it, pay, and then I have to pay to fix it. And it might be a couple $100 or a couple $1,000, or I might end up having to replace the car and get another used car. So, bit of a situation. I live in Florida and it's damn near impossible to get around without a car. So if you can help, I would greatly appreciate it. You can contribute to PayPal. I also have a link to GoFundMe in the About page of the YouTube channel. Anything helps. And as always, I'm grateful for all the support, financial or not, all the people who watch the video, comment, share, all of that. I love all of you. You guys help me do what I love. Can't thank you enough for it. So I'm going to play the clip and then I'll come back and break it down.
And also an expansion in the ACA. And let's talk about healthcare. Okay, so as progressives, we believe that healthcare is a human right. We're not going to stop fighting until we have Medicare for all guaranteed in the United States to every human being on our soil. That being said, there have been healthcare changes made in this bill. And I'll talk on the $15 minimum wage as well. So there have been healthcare changes to this bill. If you are on COBRA, what's COBRA? So first piece of good news. If you are on COBRA and your employer was covering your health insurance, so for people who don't know, COBRA is if you lose your job or, if you are no longer employed, COBRA is a way that you can keep your employer given health insurance when you're, after you leave your employment. It is so expensive. It's like insanely pricey for so many people. It's difficult to afford or to maintain. In this bill, if you have COBRA, it will be paid for, your premium will be paid for 100% until about September. So you don't need to pay COBRA anymore. And that means you can keep your insurance virtually free of cost, which is really, really, really great. There are also, but it doesn't just stop at COBRA. If you get your health insurance off the exchange, there are really important changes that mean you will pay less money and that it will not be as expensive for you. There are provisions if you make, I have my notes up here because there's like some numbers thresholds and I don't want to get them wrong for you all. So basically, this bill increases the allocations that you all get in order to better afford ACA insurance off the Obamacare exchange. So when I was a waitress, I had to go on the Obamacare website, the ACA website, and frankly it was the state exchange, the New York State of Health, and then I go up and everything's $300 and it's super expensive and it's got an insanely expensive deductible and it's like so frustrating. What has changed here is that if you buy your insurance through the ACA, you are probably going to have a lower premium across the board that you're going to pay. And it outright eliminates the premium. You don't have to pay anything on benchmark plans for people making under 150% of the poverty level, of the stated poverty level. So I need to figure out, I'm going to try to get that income number for you. But basically, and also if you're making 400% of the federal poverty level, so about $51,000 a year, if you are making about 51,520 is the number, but roughly, if you are making under $51,500 a year, you will qualify for federal help, and you will never pay more than 8.5% of, well, not never, but you will not pay more than 8.5% of your income on your premium, and that will last for 2 years. So for the next 2 years, if you get your health care off the exchange, you will not have to pay more than 8.5% of income on your premium, which is a big deal because they're really, really expensive. The federal government is also going to cover a larger share of Medicaid expenses for states that haven't expanded through the ACA. And 12 states so far have opted out of the Medicaid expansion. So let's see. Yeah. So basically, it's kind of like an enticement. Right now, there are 12 states that did not opt into the ACA and didn't get Medicaid expansion. What we're basically doing is giving those 12 states a second chance, and we're kind of sweetening the pot, and we are basically telling these states that don't accept the ACA and didn't do the Medicaid expansion. We're telling those states, listen, we'll give you even more money if you let your people get healthcare. And so because the states have to opt into it. And so it sweetens the deal, but ultimately it's up to your state. So if you're one of those 12 states that aren't part of the ACA and don't have the Medicaid expansion, talk to your local elected official, talk to your state legislature, put pressure on your governor, because that is what can help you get more health insurance covered. In New York State, where I come from and where I represent, we don't have that problem. But if you are part of one of the 12 states that haven't expanded Medicaid, you have another opportunity to do so right now. Let's see. Yeah, and the COBRA is just a huge, huge, huge deal. So we're really excited about that.
Oh, all right, so I don't know what more commentary there is to add to that. Does that look like somebody who's fighting for single payer? And she had to put the what's the little shit called? The disclaimer. Before she went on a fucking tirade trying to sell us private health insurance and trying to sell us COBRA subsidies, she had to put the little disclaimer, as progressives, we believe that everybody should have health care. We're not going to stop fighting until we get it. I mean, that is such a generic, insincere throwaway line that she's just throwing out there to get people like me off her ass so she could point to it and say, look, I said we're fighting for single payer, and they still... No, you said that because, again, it's just generic throwaway line. You don't even actually mean it. And what does that even mean? Oh, we're not going to stop fighting. Okay, but you haven't been fighting, and that's been one of the main criticisms, is that you haven't been fighting. So this whole, oh, we're not going to stop fighting. Okay, so you're just going to keep doing the shit that you're doing and hope that we get single payer? That's not going to happen. So you're just going to keep, this is going to be one of those perpetual, never-ending fights. It's the, oh, we got to fight the good fight things, even though you're producing no results and you're getting us no closer to getting the end goal. Oh, you got to fight the good fight. And she's going to keep repeating that shit election cycle after election cycle after election cycle. So that's what that sounds like to me, that little throwaway line at the beginning. But, okay, and then in context with everything else she says, and by the way, this is all she said about healthcare in this little Instagram live that she did. And it was over an hour long. So if you mean to tell me the Congress just passed a multi-trillion-dollar spending bill that was supposed to address the pandemic and economic crisis, and this is the third one that they've passed, and yet again, single payer isn't in there, instead of railing against your corrupt leadership in the Democratic Party for single-handedly denying people healthcare in the middle of a pandemic, in the middle of an emergency, instead of ripping them to shreds for it, instead of building public outrage and building public pressure to put on these Democrats to force them to give people healthcare, instead of doing that, she's going to tell you how great it is that you got COVID subsidies. She's going to tell you how great it is that they something, and all of the language in it, it was so fucking, and this is how this is another sign that you're more of a neoliberal centrist. When you're talking about policies and you're doing it in a way that makes it completely unbearable for people to listen to. And let me be clear about that, because maybe it's just me, but I can listen to people talk about policy. I can listen to discussions and debates and ideas about policy for hours at a time. I love that shit. And I feel like people in the country conflate politics and policy with being boring. But that's not the case. It's boring when you're being beat over the head with a bunch of neoliberal claptrap and, oh, if you qualify for this, if you're 400% over the poverty threshold, then you'll get this little $200 a year benefit, and you can add that to your... That's when the shit gets boring. That's when people's eyes glaze over, or gloss over, whatever the saying is. Because you're just talking a bunch of nonsense, and it's not like anything... It's the amount of nuance that you're trying to add to it is just confusing people. Because at the end of the day, what the end goal is, what the product is, it isn't really going to change their life. It isn't really going to change the system. And it really isn't going to improve this or address the systemic problems. So when people just hear you talking about, 200% or 300% over the poverty line and then COBRA subsidies till September, you don't have to pay the premium. And like, nobody wants to hear that shit. If she did that same video and said, hey, why is the Democratic Party so corrupt that they're willing to deny you healthcare in the middle of an emergency? It's a lot more straight to the point. It's more easily digestible. And there is a lot more substance there. And because it's very clear and to the point. We need single payer. That is the solution to many problems. And the obstacle to that is the corporate Democrats, is the corrupt politicians taking money from the private health insurance industry. Very straight, very clear, clean lines for people to understand what's going on and to form an opinion. But this shit, it's for even for me, this is my shit that I do. Listen to politics and policy and speeches and interviews and reading reports and all these shit. I do this shit all the time, hours a day. And even for me, it was unbearable to sit there and watch that shit. because that's the part of it. Jimmy Dore actually made this point about Ryan Grimm. Like I'm gonna butcher it, and I'm mad that I'm gonna butcher it because it was such a good point, and it's like he hides behind his boringness, and he acts he's banking on people being so bored that they tune out. And they must be like, oh my God, this guy's such a policy wonk. He's so smart that, I couldn't even keep up with it. So he must be right. He's banking on people just doing that and just tuning out in general so that they don't call him on this bullshit and say, hey, this is actually pretty dumb what you're saying. Because it requires you to be a lot more nuanced and be a lot more in depth with it. So that regular people, when they just hear it, it's just like they just want to tune the shit out. So a lot of these neoliberals and a lot of these centrists, they hide behind the boringness to make it seem like they're actually doing shit. And like they're actually, like, there's a serious plan here, serious thought going into this. But there isn't. And like I mentioned earlier, so there is kind of a implicit giveaway there. So she's bragging about something Obamacare cost and the COBRA subsidies till September. You won't have to pay any COBRA premiums till September, and for 2 years we'll provide some sort of subsidy to your premiums for the Affordable Care Act. And so in that, if you just go follow the timeline, oh wait, 2 years from now, you're saying that it's a good thing that all you would have done for healthcare is slightly cover the cost for some premiums for Obamacare. With the scale of the crisis that we're in, that shouldn't, like, if that's where your focus is, then it is impossible for you to actually be trying to get single payer. It is impossible. If you're bragging about COBRA subsidies for the next 8 months, or if you're bragging about getting these tweaks to the Affordable Care Act over the next 2 years, then that would all mean nothing if you intended on getting single payer. If you intended on using the historic leverage that these progressives have in the House and that Bernie Sanders has in the Senate, if you plan on using that leverage and that immense power to hold up all legislation in Congress, unless you get your demands met, if you plan on using any of that to get single payer, which is the solution to this emergency, then tweaks to Obamacare over 2 years doesn't mean anything. Because you would ideally be replacing it with a single payer healthcare system. But that's the thing. That's the rub. She isn't planning on replacing Obamacare with a single payer healthcare system. She doesn't even have a plan to fight for it over the next 2 years. So she's saying, yeah, the system kind of fucked up. Can't really do anything about it. Shrug my shoulders. Even though I ran on this issue and I said I'm going to fight to get you single payer, and we can get it today if people had the courage, if politicians had the courage to fight for it. We can get it today. That's what she said when she's running. Now she's elected. We're in the middle of a pandemic, worst economic crisis in history. Don't know what to tell you. I know hundreds of thousands of people are going to die because of this, but I won't lift a finger. I won't do a press conference pressuring the leadership of the Democratic Party to adopt single payer. I won't call for protests outside of the White House, outside of Nancy Pelosi's office, to pressure them to back single payer. I won't even name them in a tweet and say that the reason why they're opposed to it is because they're so corrupt. I won't lift a finger to move the dial an inch towards single payer. So just accept it. Hundreds of thousands of you all out there, you may not know it yet, but hundreds of thousands of you are going to end up dying because of my inaction here. But hey, what are we going to do? Democrats only control the House, Senate, and the White House. So this is what I'm saying. There is no urgency from them. Not from her, not from Pramila Jayapal, not Ro Khanna, not Bernie Sanders. There is no urgency to get these policies. Instead, they're going to tell you that tweaks to the Affordable Care Act is good enough. You should be happy about it and get off my ass because we did something, right? We did something to address healthcare. This is pathetic. Again, this doesn't look like somebody who's fighting for single payer.